Hello, I'm Dr. Kyu Rhee, the President and CEO of NACHC, the National Association of Community Health Centers, and I'm so delighted to congratulate Greater Lawrence Family Health Center on 45 years of providing outstanding primary care, team-based care, patient-led care to your communities and your important patients and the families. During that time, Greater Lawrence has exemplified the Community Health Center mission and movement of providing high quality, comprehensive, affordable primary care and healthcare services to all who walk through your doors, regardless of their insurance status or ability to pay. You represent why community health centers are the best, most innovative, and most resilient part of our health system. Although I couldn't be there in person, I really wanted to be, and I'm looking forward to visiting with you in the coming months. I want to tell you it's truly an honor to be a part of this celebration. As someone who lives just down the road in Needham, Massachusetts, I really take immense pride in knowing that one of our nation's leading community health centers is right there in my backyard, serving the Merrimack Valley region with compassion, innovation, and excellence. With over 250,000 patient visits every year, Greater Lawrence isn't just a health center. It's a cornerstone of this community. It's a foundation of the communities that you serve. You stand as a shining example of what community health centers across the country are all about: patient-centered care and a deep commitment to the people you serve. Nationally, community health centers like Greater Lawrence care for 1 in 10 Americans, or 1 in 5 in rural America. Yet we account for only 1% of what we spend in healthcare, about $55 billion a year, even though healthcare spend is $5 trillion. That is a powerful testament to your value, to our value, to the communities that we serve, to our efficiency, affordability. And we know that that investment in primary care and community health centers delivers savings to taxpayers in Medicaid, Medicare, and beyond. While you're celebrating this 45th anniversary, the Community Health Center movement, which started 60 years ago, you recognize that you're an outgrowth of the civil rights movement. We are an outgrowth of that civil rights movement, with the very first urban health center in Boston and the very first rural health center in Mississippi. The vision of those early founders lives on at Greater Lawrence, and I know it lives on in each of you as leaders and staff and individuals. We need to continue to break down these barriers to bring high quality care to people who need it the most in communities like yours and all across our nation. Greater Lawrence is especially known for its remarkable teaching health center residency program. I remember with Dr. Fitzhugh Mullen, a mentor of mine, when I was working at Unity Healthcare in Washington, D.C., I remember talking about the program as its concept before it became a reality as a part of the Affordable Care Act. It's amazing to see the work that you're doing with your high retention rate and outstanding reputation for training the next generation of primary care providers. It's clear you're more than just a community health center serving patients today, but looking to where future leaders and the future workforce of tomorrow is being built and developed. Also, your innovative pharmacy operations and commitment to serving diverse populations with care delivered in Spanish and other languages, that importance of cultural and linguistic concordance, represents how community health centers go beyond the exam room to address those cultural and linguistic factors, but all factors that affect a patient's health, those drivers of health. So on behalf of NACHC, I want to extend my congratulations to you on an amazing 45 years. We at NACHC value Greater Lawrence Family Health Center as a partner and supporter in our shared commitment to the Community Health Center movement. And we look forward to many more years of success together in advancing this work in the great state of Massachusetts and beyond. Thank you so much.